we are paying close attention to Botox and filler. Is when things go wrong, what do you do and who do you go to? That was a song called Sodade, and it is by Sisabi. All right, let's get into that conversation. The doctor is on standby. So, Botox and fillers are booming in South Africa. They are never out of season. You'll be surprised how many people are into that sort of thing. Not that there's anything wrong with it. Don't get us wrong. But of course, in recent case in the US, there is a mother who has left partially paralyzed after Botox injections. And that is raising safety concerns. Now, Dr. J.D. Erasmus, who's head of aesthetics at the Longevity Center at RXME, says serious complications are almost unheard of here, and thanks to the strict regulations. But should you find yourself in that situation, what can you do? The doctor warns that risk rise with unqualified injectors, as well as fake products and medical tourism. Good morning, doctor, and thank you so much for chatting to us this morning.
Good morning. It's nice to meet you, and thank you for having me.
Why Botox and fillers use is always the use of Botox as well as fillers always surging or forever in season in SA?
So, when we refer to Botox, we like to refer to the generic name, which is botulinum toxin. So, that's just our regulations on South Africa. It's just the way you have to refer to it because it's trademarked. So, for the interview, I'm going to refer to it as botulinum toxin. And in fillers, we've got a range of brands that produce them. So, that's fine to refer to it as that. But to answer your question, what's nice about fillers and botulinum toxin is that's a non-surgical approach to improving someone's confidence and also improving their skin quality and just overall general presentation to the public without having to go through real downtime or surgery.
So why do you think it's so attractive in SA specifically that it's something that is constantly in season?
All right, so South Africa has a very high UV index, so we do suffer from a lot of sun exposure effects, which are usually leads to loss of collagen and fine lines and wrinkles. South Africa has a wide diversity of skin types. When we refer to skin types, we can refer to it as Fitzpatrick 1 to 6, which just indicates the darkness of your skin and your ethnicity. So we often have a lot of people interested in Botox, in botulinum toxin, and in filler South Africa, just because of it being a very nice, accessible way of improving your appearance, and it's safe and quite easy and fast with like I said, not a lot of downtime and very, very nice effects if done by a well-qualified doctor.
Days are numbered as well after that conference.
Oh, no. They become very numbered. I think the DA becomes very nervous.
Doctor, I also wanted to check, how then do we check if someone is qualified? If I go to a doctor, how do I verify that they're qualified enough to do fillers or Botox?
All right, so we have a very easy way of making sure that someone is a qualified doctor in South Africa. We've got the HPCSA as our regulatory board, which we have to pay a fee for every year to stay registered on. When you get your degree in South Africa in NBCHB or one of the other affiliates like in Cape Town, in Joburg University, we have to get registered on the Health Professional Council of South Africa. This council has a website or a portal where you can literally go and type in the doctor that you are visiting's name and surname, or if you have the NP number, which is a prerequisite on a practice to indicate your NP number. That's the number that's allocated to you as a doctor. You will find them on the street if they are official doctors. Just to add, South Africa, if you do have your medical degree, you are allowed to inject injectables. And having said that, we do not have a specialty specifically linked to aesthetics, meaning that there's no tertiary education for aesthetic medicine in South Africa. In other countries, they do have a master's degree and diplomas available. We do have a diploma that's being run through European and American companies for South African doctors. But it's very safe to go to a doctor that has a lot of certificates showing that they did do a lot of the trainings, be it overseas or even in South Africa. That's also very nice in South Africa is that we've got very, very good company support from companies like AbbVie and Restylane and even Human. Those are all companies that's a part of the aesthetic industry, and they often make sure that the doctors that are using their products are officially trained and they are safe injectors.
And let's say then I am botched. The injections have gone wrong. What's the first thing that I must do? Because surely I can't go back to the same person that botched me. Where do I go?
So that's actually a very good question. And often when I'm consulting with my patients, I have the following analogy. When you get your hair cut, how often is it that you, after getting your hair cut and you're unhappy about it, that you tell your hairstylist about it? It's not often that you tell them. You don't want to offend them. You just don't go back to them or you go to another person. But in medicine, it's very important because we use scheduled medication and maybe category D medical devices like filler. It's very important to follow up with your doctor. So even if you are unhappy with your outcome, let's say you think it's botched or you're unhappy with the way that your brow is sitting, maybe you have had a Spock look or you had a drop brow or maybe you had a ptosis, it's very important to inform your doctor and the actual injector who did it. The reason why I'm saying that is in South Africa, we've got a very, very strong ethic component to South African doctors. They would rather want to try and sort you out themselves because they are the one who caused the problem. And I must say, in more than 90% of the cases, in my industry, in aesthetics, it is something that the doctor that did the injection can sort out themselves. This also leads to great patient retention because you actually helped to sort out your patient's problem, even though you might have been the cause of it. And in patient education, before you start with your injections, is very important so that they can understand what you expect. And me personally, in my practice, always give my personal number for emergencies after I've completed a procedure. The reason for that is with botulinum toxins, it's not that serious. I mean, we did read about those few cases overseas. By the way, there's no documented cases of iatrogenic botulinum in South Africa as of yet. But if we look at further, we can lead to vascular occlusions. There can be skin necrosis because of causing an embolism in one of your arteries if you inject the filler into an artery. It's very important that you then definitely contact your doctor immediately because that is time dependent to have a nice outcome to correct that treatment.
Right, doctor. And so for people that want to know where to go for legit research, because it doesn't all mean that it's going to go south. Where can I go if I'm doing research? Maybe I'm interested in it and I would like to do research for myself. Is it advisable to do websites, or I can ask the doctor that I would like to do it with, to say this is what I'd like to do, what are the pros and cons and all of that?
So I'm not sure about all the other doctors in the industry, but I love it when my patients come to me educated or when they have read up something for themselves. It gives you the opportunity to open the conversation for proper scientific backing papers. So when we do offer ethical practicing of aesthetic medicine in South Africa, it is often evidence based medicine that is being practiced. That means it's a treatment that I base on scientific data that has been published. So referring to the specific article that we did write a press release for, botulinum toxin is one of the most studied aesthetic treatments in the world. One of the companies, which I can't name, because of legal reasons, have over 7,000 publications on the safety, the efficacy, and the patient satisfaction with their product for aesthetic treatments. So if you want to know more, it's very advisable for my patient to rather go onto the internet and use Google Scholarly and use reputable sites to gain the information. And then always bring it into consultation with your doctor, who will guide you then if you did not understand something that you did read. This is important because the case in America, as it might have happened, has several factors to it. And after I've gone through it several times, I've realized there's multiple factors, and it's not something that necessarily can be deduced that it was linked to the botulinum toxin injections. But then with further research found cases in Europe where there was over 70 linked confirmed cases to two hospitals. This is important to note that because of our degree, we've got the ability to really assess a article well, and we've been taught that because we have to publish our articles ourselves as well. In that specific case, there were 70 reported cases, but they all were off-label use. So that means the package insert of the company that's supplying the registered product that is supposed to be safe was used off-label, meaning it wasn't indicated for that purpose, which is possible if you're a doctor. You can use your insights to use it for a different reason. For example, you want to inject botulinum toxin in the masseter muscle for clenching and for an overactive clench and grinding of your teeth. That's off-label use, but we know it's very safe and in the right hands. But in these cases, in I think it was Turkey, they used over 1,000 units in some of their cases. That is a lot of toxin. So in aesthetic treatment, we can often range from 50 units to 64 units being your optimal dose. But there are people like men that need 74 units. But that just gives you an indication of how few units we use in terms of the cases that were reported with iatrogenic botulinum.
All right, Doctor. Thank you so much for that education this morning on Out and About, and may you have a fantastic Saturday going forward.
Thank you so much. I hope it was helpful, and I know we do talk a lot of science always, but if there's any questions, they're always welcome to ask. All of the doctors are very excited to teach our patients about the treatments that we have available and the safety profile that they have, and if they have any concerns, they just need to ask.
All right. Thank you once again, Doctor.
Have a good day.
It's Dr. J.D. Erasmus, who is head of aesthetics at the Longevity Center at RXME. And we're talking about should you find yourself in a sticky situation, what should you do? And how do you avoid finding yourself in a sticky situation with Botox and fillers? But okay, so now from my conclusion, I think they kind of get addictive, because have you seen someone with like fillers and just like, oh, that's just a lot. So and you see that in that case, you can't then blame the doctor and say, yeah, your doctor. What if she keeps on saying, I'm coming back? Because remember, this is a fully consenting adult who says, I want bigger and bigger and bigger. So it's not a very good representation on their doctor as well. Remember, you can also get in touch with us on WhatsApp at 063 rather 4069126. It's Out and About.